Rohan.
Hi. Thank you, Dr. Salner, for helping me with my presentation on nuclear energy. I'm going to ask you some questions about this topic.
Okay, great.
What are the uses of nuclear energy in the hospital?
What are uses of nuclear energy in the hospital?
Yes.
Okay. If you define nuclear energy as use of radioactive material or nuclear isotopes, would that be a good definition of what you're asking?
Yes.
Okay, great. We use nuclear isotopes or radiation isotopes for many different purposes in the hospital. And so let me tell you about a couple of those. One would be that when we label certain radiation isotopes to other things, we can, using a camera that detects the electrons or energy that spins off from those isotopes, we can image certain parts of the body. So, for example, there's an agent that we can inject into a vein in the patient, and then they can exercise, and that agent the heart muscle, and we can image how well the heart muscle is getting oxygen and blood. And it shows us if there are any parts of the heart muscle that are not getting enough blood, and that might give us a clue that the patient needs some further tests to determine if they're might be having a higher risk for a heart attack. So the imaging for radiation isotopes is one major use. In cancer, because I'm a cancer doctor, one of the things we use for it for imaging is something called a PET scan. And that's where we label an isotope that's a radioactive sugar. And as you know, the cells in the body use sugar, right, to survive. And some of the parts of our body need a whole lot of sugar, and some need only a little bit of sugar. The two organs in the body that use the most sugar are the brain, because the brain, we're always thinking, and so our brain uses a lot of sugar to do its work, and our heart muscle, because of course our heart is always beating, and the heart muscle uses a lot of sugar. It turns out that cancer cells use a lot of sugar because they're rapidly dividing and metabolizing. And so when we inject this radioactive sugar in a scan we call a PET scan, P-E-T, and P-E-T stands for positron emission tomography. So it doesn't have anything to do with our dogs or cats. It's not that kind of PET. It's a positron emission tomography scan. Those isotopes can tell us where in the body the cancer cells might be. So if we've just diagnosed a patient with a new breast cancer or a new esophagus cancer or several other cancer types, lymphoma, we can inject the sugar and take a picture of the patient head to toe and find out exactly how extensive the cancer is. Is it just in one place, or has it spread anywhere? That helps us to stage the cancer, Rohan, which means that when we know how much it's spread to any part of the body or not, we can then develop the best treatment for the patient. So if it's just in one spot, we might do an operation to remove the cancer. If it's in multiple spots, like in multiple lymph glands in an area, we might use radiation given externally to treat the patient. Or if it's spread to multiple parts of the body, we might actually use a chemotherapy treatment, a drug that the patient takes a pill for, gets an injection for, to treat the cancer. So the imaging part of radiation isotopes is really important. The thing that I use radiation isotopes for a lot is to actually treat cancer. Because just like I mentioned to you that cancer cells are rapidly dividing, we know that if we treat them with radiation, radiation damages the cell's ability to divide. So if we damage the cancer cell's ability to divide, it causes it to die. And so we can target cancer cells with radiation, which is either electronically produced radiation from a machine called a linear accelerator. That's not a nuclear isotope. That comes from an electronic machine. Or we can use an isotope to treat the patient. And when we use radiation isotopes to treat the patient, we call that brachytherapy. Brachy is spelled B-R-A-C-H-Y therapy, and brachytherapy means that we put the radiation very close to where the cancer cells are. And so, for example, if I'm treating somebody's prostate cancer and we decide to treat it with radiation implants, I'll actually bring the patient to the operating room, and through some little needle holes that we put through the underside of their behind into the prostate, we can implant radioactive seeds that contain palladium-103. That's an isotope that's inside of little titanium seeds, and I can put 60 or 80 palladium seeds into somebody's prostate, and those palladium seeds will give the radiation dose out locally to eradicate the patient's prostate cancer, and that works very well for the right patient. So in the hospital, the two main uses of radiation isotopes are either for imaging or for cancer treatment.
Thank you.
Sure.
Next question. What types of diseases can they treat?
Okay, good question. Well, from the cancer perspective, we use the brachytherapy that I just mentioned to you to treat cancers in the prostate and breast, and a type of tumor called sarcoma, which is a soft tissue type of cancer. We use brachytherapy to treat women's cancers of the uterus and cervix and vagina. We use brachytherapy to treat cancers, selected kinds of cancers in the airway of the lung, a structure we call the bronchus. Let me think what other applications we use for brachytherapy. Those are the main ones that we use it for: the women's cancers, the prostate and breast cancer, and bronchus and sarcomas. For imaging, I gave you examples of imaging for the heart, imaging for PET scanning to look at cancer extent. We use it to look at cancer cells in the bones. We use radiation isotopes to image for looking for certain kinds of infections in the body, for looking at places where there might be an abscess, which is a collection of an infection of a particular kind. Let me think. I think those are the main kinds of imaging applications we use it for.
Okay. Are the patients protected from nuclear radiation?
How are patients protected from nuclear radiation, or staff, yes, or what was the question? Or how are people?
How are the patients protected from nuclear radiation?
Okay, great question. Well, the nice thing about many of the radiation isotopes that we use is that the distance the radiation travels from the isotope is very short. You could measure it in a millimeter or even in microns, something very, very short. So, for example, one of the isotopes that I didn't mention to you is something called radium-223. And that's an isotope that we inject into a patient's vein that goes to the bone for patients who have cancer that's spread to the bone. The radiation-223 is an alpha emitter. So when we think about isotopes, we think about them emitting alpha, beta, and gamma rays. And the radium-223 is an alpha emitter. It only travels as far as the thickness of a piece of paper, Rohan. So it's very short. So it doesn't expose the rest of the patient to any radiation. It homes in on the bone abnormality where the cancer cells are, and it just gives the radiation to that area. In other situations where we give radiation, we have to warn the patient that for a short period of time they may be radioactive. And that, of course, depends upon the half-life of the radiation isotope we're using. Some radiation isotopes have a very short half-life, and some of them have a very long half-life. With the patients where we only put the radiation seeds in temporarily, like when we're treating the breast tissue or the gynecologic area, the women's cancers, that treatment only takes 10 minutes. And during that 10 minutes, the patient is isolated in a room alone, and they're comfortably lying down, and the isotope is sent in remotely into the cavity where the radiation is dwelling. It gives the radiation locally only to that one spot, and then after the time, and we're monitoring the patient from outside the room on a TV camera, and we're talking to them and listening to them and watching them. And after the calculated dose is delivered, the radiation automatically is withdrawn back into a lead safe where there's no radiation coming out of. So in that situation where we're using temporary radiation, the radiation is highly localized and the rest of the patient is safe. In a situation where we inject the patient with a radiation isotope, like for a scan or for that radium-223 that I told you about, the patient is minimally radioactive for a very short period of time, and we tell the patient how to use certain precautions so that they don't get any excessive radiation.
Okay. Does exposure to Does the exposure to nuclear radiation hurt?
Well, I think exposure to nuclear radiation hurts.
No, does the exposure to nuclear radiation hurt?
No. The radiation that comes out of a radiation source is, you can't see it, you can't smell it, you can't feel it. And that's one of the things that makes us have to be very careful about how we use it. And also, in addition to a doctor like me who specializes in radiation oncology, I have a team of experts who are physicists and dosimetrists and engineers, a lot of people who work behind the scenes to help calculate the actual dose and regulate the radiation so that it is going to be used safely, because there's no way you can feel it or see it when it's actually there. So you have to make sure when you're using it that it's going to be very safe for people.
Thank you, Dr. Salner. Bye.